This will be part 3 and hopefully the last recording for chapter 7. We're going to start with the appendicular skeleton. So we're in part 2, the appendicular skeleton. That's going to be the upper limbs and lower limbs, which pretty much we just say legs and arms. And then it's also going to include the pectoral girdle, which consists of the clavicle and scapula, and the pelvic girdle, which consists of the pelvis and the sacrum. So, pectoral girdle or shoulder girdle consists of the clavicle. Clavicles is the collarbones, and the scapula is your shoulder blade. All right, there's a A&P Flix animation. Let's see. This is slide number 136. And here is an illustration of the pectoral girdle. Here's the clavicle. And then you have the scapula, which is all behind here, but you have the clavicle, the scapula, and basically the scapula has this cavity that the head of the humerus fits into. So the pectoral girdle is going to be associated with the shoulder joint, and it does allow greater mobility than the hip joint, but does not have as much stability as the hip joint. It's not as stable. Okay, here's the clavicle or the collarbone, and then the scapula or the shoulder blade. And the only thing I'm going to say with the scapula, I do want you to know a couple of structures in the scapula. I want you to be familiar with the acromion, which is a lateral projection that articulates with the acromial end of the clavicle. I'll show it to you. You don't have to ever know definitions like that. I would just want you to be able to, identify it on the bone. But the shoulder joint is called the acromioclavicular joint because it is where basically the two bones that form the joint are the clavicle, which is the collarbone, and then the acromion of the scapula. That is where they connect. And then there is the acromion. It says a lateral projection, but that's what I was looking for. Oh, the glenoid cavity. The glenoid cavity is the structure in the scapula. It's a fossa, and and a fossa is a cavity. So it's the structure in the scapula right here that kind of it's definitely concave, and it's like a shape that fits a circular structure. So there it is, the glenoid cavity. The glenoid cavity fits the head of the humerus, which is your upper arm bone, fits into the glenoid cavity. And then you also have the acromion here, which is where the shoulder joint, that's the other part of the shoulder joint that articulates with, the acromion articulates with the clavicle, and the glenoid cavity articulates with the head of the humerus. Upper limb bones. The arm means in anatomy, the arm means upper arm. So whatever you need to do to remember that, when we use the word arm, that automatically means upper arm. And the bone in the arm, in the upper arm, is the humerus. So the lower arm, we give that a whole different name. We call it the forearm. And it has two bones, the radius and the ulna. And I always remember the radius is on the thumb side of the forearm. Radius is on the thumb side. Then in the hand, the wrist bones are included in that. So there's 8 wrist bones or carpal bones, and then 5 hand bones or metacarpal bones. And then your finger bones are called phalanges, and there's 14 of those. There's not any structure that I need for you to know, but this is a picture of the humerus, and up here at the top, the superior end, or it would be more appropriate to say the proximal end, because it's the closest end to the shoulder. Anyway, the proximal end has a head, which is a rounded structure that fits into the glenoid cavity of the scapula, and that forms the shoulder joint. And then you have this structure down here, which is called a trochlea, that forms the elbow joint with the ulna of the forearm. And well, you can see it. Okay, here's the trochlea of the humerus, which articulates with both the radius and the ulna and forms that shoulder joint. The way that I remember the radius, in fact, look at it over here. You see how the head of the radius, it's actually like a flat circle. I mean, it's a flat, rounded circle that's stuck on the top of that radius. When I see the bones, I always know the radius because that the superior end of it, is like that. And I also remember it because the radius is on the thumb side when someone is in anatomical position. Well, it doesn't even matter what position they're in. The radius bone is on the thumb side of the forearm. So the one thing I will say is the ulna is the bone that contains the olecranon, and the olecranon is the elbow. It's the if you bend your elbow right now, and just take the hand of your other limb and touch it, you can feel your elbow. It's a bony point there, and it's called the olecranon. Okay, so that bone that is actually the olecranon is actually part of the ulna. All right, and the homeostatic imbalance tells us about the Colles fracture, which is a break in the distal end of the radius. That means the end closest to your hand. The proximal end of the radius is closest to the elbow, but the distal end is closest to your hand. So a Colles fracture is common because what happens is a person who's falling attempts to break their fall with their outstretched hands. And that will result in a Colles fracture, which is a break in the distal end of the radius by using your hand to break your fall. Okay, and the hand, you have the carpals, the metacarpals, and the phalanges. And I'll go ahead and tell you, I know a sentence, and it's a little bit, well, I don't know. It's weird to say this sentence to a computer screen instead of to a classroom full of students, because it's just a little bit, I don't know the word. I mean, it's not bad, but to learn the bones of the wrist, the carpal bones, if you'll learn them using a sentence, even if you don't use the sentence I'm about to give you, you can Google, or you can search. That everybody tells me I sound old when I say you can Google it. You can search on any browser that you choose. You can search for a sentence to help you remember the carpals. But anyway, it's the first row of the carpal bones. There's like 2 rows of 4 bones each. Okay, so the proximal row will be the row that is closest to the elbow, and the distal row is closest to the hand. So on the proximal row, you have the scaphoid, lunate, triquetrum, and pisiform bones. And then on the distal row, closest to the hand, you have the trapezium, trapezoid, capitate, and hamate. Okay, and let me think if I can remember. Here's the sentence. I'm not writing it down, but I will say it out loud one time. I'll say it out loud very clearly. Maybe I'm just like one of those people that gets embarrassed talking about, sex. But anyway, some lovers try positions that they can't handle. There you go. You got it recorded. All right, so we don't have a lab practical though, so it's not like you have to memorize those, but that is something that when I teach it in the classroom, we have a lab practical and they have to know those wrist bones. All right, the only thing about the phalanges is your thumb, which is your first phalange, I think is how you would say it, phalanx. Your thumb has 1, 2, 3. Well, it's got the same one. So it's got a proximal segment, middle, and distal. That's not right though. 1, 2, 3, 4. Okay, this isn't the proximal segment. This is part of the hand. I'm sorry. The thumb has 2 bone pieces, and the other phalanges have 3. They have a proximal, a middle, and a distal bone that forms the finger. Okay, so the thumb only has 2 bone portions, and the fingers have 3. Okay, so and then this is a picture of your wrist bones. You're looking from the this is from the open palm, because this is our anterior view. Remember, with a hand, it's like you have to remember that the person is in the anatomical position, so their palm is facing forward. So this is the palm facing forward, and the I'm going to start with, okay, so scaphoid, lunate, triquetrum, pisiform. And you can feel that pisiform bone at the bottom of your palm. You can feel it. It be on your pinky side. You can feel that bone kind of poking through. So we've got scaphoid, lunate, triquetrum, pisiform. And then we have trapezium, trapezoid, capitate, hamate. And our sentence is, some lovers try positions that they can't handle. And that will help you remember those. All right, our homeostatic imbalance is about carpal tunnel syndrome. And that that is associated with the median nerve, and then also the tendons that travel through the carpal tunnel, which is formed by the wrist ligaments. Okay, so it's called carpal tunnel syndrome, and it can occur from overuse, particularly like with a laptop. And it can occur from overuse and inflammation of the tendons, which can compress that median nerve, and it causes tingling and numbness. So the pelvic girdle, so now we're going to do look at the lower limb and the pelvic girdle. The pelvic girdle is also called the hip girdle. It is formed by the 2 hip bones, also called coxal bones, or os coxae. Coxal bones is fine. So there's 2 coxal bones that form the pelvic girdle, and the sacrum. I was getting ready to say the 2 coxal bones and the sacrum. All right. The hip joint in general has less mobility than the shoulder joint, but a lot more stability. The fused bones that form the coxal bones are the ilium, the ischium, and the pubis. And then I do want you to know the acetabulum, which is the socket that holds the head of the femur at the hip joint. So the acetabulum is analogous to the glenoid cavity at the shoulder joint. This is like the glenoid cavity of the shoulder joint. Glenoid cavity was in the scapula. The acetabulum is in the ilium of the coxal bones. Or is it in the ischium? You know what? I think it's the ischium. I'm not sure where the ilium ends and the ischium begins. Actually, I think the acetabulum is in the ischium, because here's what you have. You have the pubic bone, which would be. I just want to show you like the whole. Okay, so this would be the upper part here. Okay, so the large wide hip bone is called the ilium. Okay, then about along where it sort of narrows, it starts narrowing. This is the pubis, and between the two pubic bones is the pubic symphysis, which is made of fibrocartilage, and this is what this pubic symphysis is going to soften and become stretchy during labor, so that the female hips will widen, and this whole area will widen, so it will be easier for the baby to fit through. Underneath the pubis, or inferior to it, in the back too, it's also posterior, is the ischium. So this is the ischium, and that's why I say I'm not sure, but I think the acetabulum is part of the ischium. Anyway, you're never going to be asked that question. But your sitting bones are is the ischium, and it's a structure down here at the bottom of the ischium called the ischial tuberosity. So let's see. Oh, it'll tell us in the notes, I bet. The ilium okay, there's nothing you actually need to know. The ischium. Oh, I want you to know for the ischium that it has a bone structure called the ischial tuberosity, and that's what we call our sitting bone. The ischial tuberosity is the bone you actually sit on. And then for the pubis, you have the, within the pubis, you have the obturator foramen, which is the large hole, the large opening. I was just seeing if it was labeled. I guess not. But anyway, it's just the opening where a baby's going to come through. You have the pubic symphysis, which is the fibrocartilage that joins the pubic bones. And now I need you to learn how to tell the difference in the male and the female pelvis. And by the way, this answers our question. The acetabulum is part of the ischium, which is purple, and it is part of the ilium. So, and maybe even, yep. So you can't say the acetabulum is in one of those three bones. It's just, the acetabulum is a cavity that holds the head of the femur, and we can just say that it's found in the coxal bone. The ischial tuberosity is here, so this is our sitting bone, the structure we sit on, and the obturator foramen right there. Is not what I was showing you. I'm sorry. I can't find. I don't remember the name of this opening here, but it's talking. The obturator foramen is talking about this. I'm sorry. I apologize for that. Again, I'm never going to ask you. I'm just trying to point out things, you know. Let's see. For males and females, the female pelvis is wider and rounder. And the male pelvis is narrower and not as round. So what you're looking at here, it says the female false pelvis is superior to the pelvic brim, and the true pelvis is inferior to the pelvic brim. I won't ask you about that one either. It's just the pelvic outlet, this area is going to be much more open, wider, and longer than for a male. So if you look at, I'll blow this up, if you can see the different views of the male and female. Okay, so first of all, this outlet in here is narrower, is just smaller in general in the male, and then in the female, it's much wider and rounder. In the male, you also have this angle that forms here. That angle is going to be less than the same angle in the female pelvis. It says the angle is more acute. That means it is a smaller angle. It's 50 to 60 degrees, whereas in the female, it's almost like widened out to, it's not quite 180, but, I was like, this is not 50 to 60. I'm sorry, it's this angle right here where the arrows are. I was thinking about something else and not paying attention. So 50 to 60 degrees, it's like a little larger than a 45-degree angle. It's called the pubic arch. But it's in the female. The other angles are also, I mean, you could say the same thing, but you definitely can't say that this is a 50-degree angle. But this one, yeah. All right, so with the female, it's going to be a wider angle in the female pelvis. All right, let's see here. And there is a table that compares the male and female pelvis. You can see them here again, female versus male. You also see like the coccyx and the sacrum are closer in, so there's not, I mean, it would be terrible for a baby to try to come out through this hole, versus this one. Lower limb, I'm going to try to cover this. All right, the thigh bone is called the femur, and it is the largest and strongest bone in the body. It articulates with the acetabulum of the hip and at the hip joint, and also articulates with the tibia and the patella, which of course is the shin bone and the kneecap. The patella is a sesamoid bone. That means it forms within a tendon because it formed within the quadriceps tendon, and it does form the knee. The kneecap is what we call it. All right, within the thigh, I don't see any structure that you need to know. I mean, when you look at the femur, I'm just going to point out to you, the femur has a head and a neck, just like the humerus of the arm, but the neck is much longer in the femur. And the femur sits a lot deeper in the hip socket than what the humerus does in the shoulder joint. All right, the leg, now here you go. Here's another thing. So I told you the arm is always the upper arm. The leg is always the lower leg in anatomy. Leg is lower leg. So the upper leg, you don't call the upper leg, you call it the thigh. So leg has two bones. One is the tibia, which is the primary bone. It's much larger and thicker, and it forms like the shin. And then the fibula, which does not bear any weight. It's not a weight-bearing bone. And it does not articulate with the femur. In other words, it plays no role in forming the knee joint. But it is on the lateral side of the tibia, and it's kind of thin and, looks kind of like it might be breakable. Homeostatic imbalance, it says a bimalleolar fracture is a break in the distal ends of both the tibia and the fibula, both at the same time. Distal ends means the part closest to the foot. And it is a common sports injury. All right, you do have 7 tarsal bones, and I'm only going to mention one, and that is the calcaneus, which is the heel. So of the 7 tarsal bones, the talus and the calcaneus carry the body weight, like when you're standing. So the talus and the calcaneus of the foot, of the tarsal bones, the ankle, they're going to support most of the body weight when you're standing. So the big toe, the big toe or the great toe has no middle phalanx. It's only got 2 parts, just like the thumb. And then the other toes have 3 parts. And then here you see the calcaneus and you see the talus. The talus is like the top part of your foot, the top part of your ankle, and then the calcaneus is the heel. All right, you see them again, the talus, and then the calcaneus here. The calcaneal tuberosity actually is specifically your heel bone. Okay. There's flat foot or pes planus. My dad had that. He couldn't join the military. He did. I can't think of the name of it, but you know when you go into the Army Reserves, he did the Army Reserves, but he had flat feet and they wouldn't let him join the Army. But pes planus or flat foot, sometimes called fallen arches, and you just need to wear a shoe with a good arch support. There's something here about the fontanelles. Fontanelles are soft spots in the skull of the infant that ease birth and also allow for the growth of the brain. It's the purpose of the fontanelles. You can see a picture here. Homeostatic imbalance, a cleft palate is the most common distortion of the skull. All right. Basically, there's no fusion, no medial fusion. In other words, no fusion in the middle of the palate. No medial fusion of the 2 halves of the palate. It interferes with sucking, so it can cause the baby to be malnourished, and it can lead to aspiration into the lungs, which can cause pneumonia. So it's not only is it a physical deformity, it's not, in other words, it's not just a cosmetic procedure to repair a cleft palate. It's actually a procedure that when they repair a cleft palate, it's a procedure that's, it is cosmetic too, because the individual, they look better, but it is also necessary medically. And there's some other stuff about infants. And so the only thing I'm going to mention is developmental dysplasia of the hip. Oh my gosh, my nephew had that. He had a little limp. And it happens in breech births, and I'm pretty sure he was. But anyway, it can just happen in the birth process. All right, that is it. I know I went way over. It's almost 30 minutes, but this is the end of the Chapter 7 recordings.